We are live now, doctor.
Good evening, everyone. Welcome to our session on medical legal aspects related to medical tourism, conducted by the legal team of YOSI. So, I, Dr. Aarti Heda, Dr. Dipanshu, and Dr. Riddhi, we are in the medical legal team. So, we have already conducted webinars on multiple topics, and they are available online in the YouTube channel of YOSI, YouTube channel. So, this is the 26th session. So we are grateful to have our mentors always, Dr. Anant Deshpande sir, Dr. Manoj Mathur sir, Dr. Prakash Marathe sir, and Dr. Nirmal sir has also joined as a panelist today. So Dr. Nirmal Frederick sir is the editor-in-chief of the Journal of Ophthalmic Science and Research. He has played pivotal role in NABH and the regulations related to eye care organizations in NABH. He is the member secretary of technical committee of NABH for eye hospitals, eye bank accreditation program. He was member of managing committee of AIOS from 2009 to 2017. He was IMA NHB secretary. He is currently the president of Tambaram Ophthalmic Society. He is formerly assistant professor of ophthalmology in Madras Medical College. He was formerly secretary treasurer of Tamil Nadu Ophthalmic Association, in which he currently holds the post of immediate past president. He was awarded AIOS Preeti Nasrajan Award for Best Eye Hospital Administration in 2017. Welcome, sir. We are privileged to have Dr. Prakash Marathe sir with us. He is a consultant ophthalmologist at Netrayogi Eye Clinic, Pune. He was past president of Maharashtra Ophthalmic Society, Pune Ophthalmic Society, and Indian Medical Association, Pune. He is a trustee of Pune Ophthalmic Society and IMA Pune. He is a member of Medicolegal Committee of AIOS. He is a chairman. He is the chairman of Maharashtra chapter of ISMS ISCS. He is a past managing committee member of AIOS. He is past senior vice president of IMA Maharashtra State. He has got multiple awards, including President's Appreciation Award by National IMA Headquarters, President's Appreciation Award by IMA Maharashtra State, and President's Special Felicitation Award by IMA Maharashtra State, and late Dr. Asa Kelkar Award. We are privileged to have Manoj Mathur sir with us, who has been guiding us from the beginning. Sir is a senior consultant in glaucoma and comprehensive ophthalmology at Swarup Eye Center, Hyderabad. He is presently the honorary treasurer of AIOS. He is past advisor and president of Telangana Ophthalmology Society and Hyderabad Ophthalmology Association. He is co-chair of Health Insurance and TPA Committee of AIOS. He has been a member of Medical Legal and Ethics Committee of AIOS in the past. He has been twice a member of Managing Committee of AIOS. He has also served as a member of Advisory Board of IGO. Welcome, sir. So we are privileged to have our mentor as our speaker, Dr. Anant Deshpande, sir. He is the director and eye surgeon at Guru Prasad Netra Rugnalaya, Aurangabad. He is the chairman of Indian Medical Legal Consulting Services Private Limited. He is chairman of Medical Legal Committee of AIOS. He is a faculty of law and visiting professor to Symbiosis Law College, Pune. He is a faculty of management sciences at BMU Aurangabad. He has written various books like Legal Aspects of Ophthalmology, and he has played pivotal role in formulating the consents which are circulated to all Indian ophthalmologists by AIOS. Thank you, sir.
Should I continue? Start?
Yes, sir. Please start, sir.
Screen is visible?
Yes, sir. Your screen is visible.
Yes, sir, you can start.
Yes.
Yes, sir. The slides.
Legal liabilities and legal aspects of medical tourism. Medical tourism has become a very big portion of medical practices in all over the world. So India is not behind in that. So medical tourism may be defined as activities related to travel and hosting a foreign tourist. So both the things are there. The activities are travel and hosting the tourist who stays at least one night at the destination. So the rule is that at least he should stay at least one night in the destination place where he is touring. For reasons to maintain, improve, or restore health through medical intervention, such medical interventions may be broadly classified into three categories. So generally, it is associated with tourism plus medical treatment, maybe medical intervention mostly, because medical line of treatment, that is medicine, are generally less common, but surgeries, interventions are very common because of the so many reasons that I am going to say in future. The reasons for main improve the restore health through the medical intervention. Such medical intervention may be broadly classified treatment of the curative purposes. It may be for curative purposes, that is for some operations, interventions or treatment. For aesthetic reasons such as the cosmetic surgeries, because it is a very costly surgeries outside the India, and in India they are of the same standard with a lower cost. The access to traditional systems of the medical such as Ayush, Ayurveda, Yoga, Naturopathy, Naturopathy, Unani, Siddha, and Homeopathy. These pathies are mainly available in India and they are originating from India, most of them. So the thing is that there is a pleasure to come to the India and take these pathies treatment and use that. Global Wellness Institutes has defined wellness tourism is another thing, but wellness tourism is not the medical tourism, but many times the wellness tourism and the medical tourism are joined together so that the clients are more, because people want wellness in their life nowadays, and that is different. So separate मला थोडंसं छोटं करायला पाहिजे होतं. आय विल डू इट. तरी एवढंच होत आहे.
So no, because that strip may be coming and blocking his.
Yeah, strip is blocking.
Yeah.
How to?
So you just go to the view section, sir. More at the top.
Okay.
You just select standard.
Okay. Yes.
View on the top strip.
Top right, sir.
From where it will go? Yes. Global wellness. So they are joining wellness because people want wellness in their life, balance of work and uh, peace of mind, and for that purpose also they travel, and that is also associated with the medical tourism. Medical procedure includes cosmetic surgery, cardiac surgery, orthopedic surgery, and dental procedures mainly. Patients and other surgeries are also possible, but generally people come for this. Patients and their families are attracted by the availability of better quality and care price at a destination. So they are always see how much is the price of cost of the treatment. Therefore, a successful medical tourism depends upon the status of the country's border medical sector along with appropriate government regulations. So there should be regular government regulations also in favor of the medical tourism. Patient safeguards, and most important is that they see the safeguards also should be there. Training standards and insurance framework, which is also a very important thing. Unless insurance is there, nobody is going to take the treatment because they don't want to spend from their own pockets. The safeguards, insurance framework, travel and visa restrictions, and other issues that drive the patient's experience and treatment outcomes. So, visa, how the visa is given or not, whether it is easy to get or not. So, all these things are there. So high-end healthcare system in India is as good as best in the world. Complex surgical procedures are done in world-class global hospitals by acclaimed medical specialists, such as the lowest cost than what is normally taken. So the people in the medical field in India are well known, and they are doing the surgeries and doing the work at the top level, at the comparable to work anywhere in the world. Apart from that, yoga, wellness, ayush, all these are there, which attracts the people in India. Facilities play a crucial role in providing a bridge between the medical value level traveler and the services provider. So airlines, the service provider are there because doctors are not going there, hospitals are not going there, but there are many service providers who bring the tourists, and they are attached to some hospitals and they take the treatment in that hospitals. Airlines and hotels also have an important role, that is ease of airlines and economically low cost, and hotels of good quality with low cost. The safety of the medical tourism in India, India has a good number of JCI, Joint Commission International, accredited hospitals and compares well with. So India is having many good hospitals which are accredited with Joint Commission International and NABH. So the standard of the hospital is very good and comparable to hospitals anywhere in the world. So the people prefer Indian hospitals for treatment. And coming to that, health and safety risk for medical tourists, complications, what are the safety specific concerns regarding organ transplantation. So many problems are there with the organ transplantation, and the complications may be a part of that. Transmission of antibiotic resistant organism, that is also a very big problem for the foreign countries. Many strains are there in India which are resistant to the antibiotics, and they may carry that strain to their country, and the people may get infected. Other peoples may get infected, and they can spread that strain in their country. Discontinuity of the medical documentation, because many times whole documentation is not given to the patients, and so there is no continuation of the documentation when they go back to their country. You are uninformed decision making. So many times the decision making is done by the doctor, and information, the way it should be done, is not done. Risk of India in medical tourism, with Indian ranking 10th in the world of the medical tourism. So India is ranking 10 in the medical tourism. And the famous test is Chennai, where multi-super specialty hospitals are there, and about 150 international patients every day they cater. And nearly 45% of the medical tourism is in the Chennai. Arriving of the country, 30 to 40 of the domestic health and also 40% of the domestic tourism also there. So there is two types, that is international tourism and domestic tourism. Domestic tourism also takes place that people move for seeing the places and take the treatment. Strengths of India: medical value level destinations are top of the line medical and diagnostic equipments are there, which are compatible with the world standards. Most of the medical practitioners and surgeons of India hospitals have a reputation of high quality medical training, and the doctors are very much trained and they have worked in some leading medical institutions and they have a good experience, so they are preferred by the tourists. Most of the medical practitioners and nurses are fluent in English. So our language English command is good and understandable to all the countries. The tone is understandable. The cost of the quality of the medicine is services is low in India when compared to the other companies in the field. So cost is also less. There is no waiting time and the patients can get immediate treatment. So in other countries, lot of waiting time is there, 2 months, 3 months, 4 months. But in India, immediately they can take the treatment and there is no waiting time because lot many hospitals are there, lot many surgeons and medical field is flooded with the medical health workers. India has the unique advantage of offering Ayurveda, yoga, naturopathy, and other traditional systems of medicine for the treatment of various elements of the enriching. When the element is of a long standing, they want the Ayurveda or naturopathy for the treatment. And our yoga also is very popular from India. It has spread from India to all over the world, and it is also an attraction to the tourists. When the recent focus of the government has India has built tremendous capacity of Ayush. India has a good number of IGC Joint Commission International Accreditation Hospitals. So Ayush has accredited the many hospitals Joint Commission of International and compare with the other countries in Asia. So India is having more such hospitals compared to other Asian countries, and also the NA-based hospitals accreditation is also in high standard and it is in high number. This setup approval hospital in India provides care at par above the global standards. So what are the global standards? And Indian standards are above the global standards. Mean India is giving treatment and the standards are above the normal standards of the other countries. India offers a range of tourism opportunities to the medical value, travels to combine the treatment with a visit to tourist destinations. So apart from that, there are many tourist places where the people can go and see. Now, another thing is that visa. The important reason in the association are the which can be available visas. India has a M visa, which gives, once you get the M visa, you are there for 1 year and another 1 year can be extended, and waiting time for produces in India is less. Legal assistance available in the medical tourism in cases of the medical malpractice. So legal assistance is also available, and M visa gives a lot many facilities like there are no regulations. The weaknesses in the our system are there, and they are govern the MTVT sector. So the regulations are not there, which will be governing that. The this leaves a sector unorganized and lacks monitoring of the quality of the services by stakeholders such as MVT facilitators and service providers. So they are they there is no standard or there is no control over the service providers, or there is no system laid down which can control them. there is a need for greater support from the government towards regulations, facilitations, and marking the India as a medical value travel destination. So these are the weaknesses in of the India in the medical tourism. Due to the unavailability of the price range, the medical tourism facilities sometimes cheat the patients. So there is no standardization of the fees. There is no standardization of the value of any surgery or any treatment. So there is a cheating also seen in India. So that is also a drawback. Perception about the India not being a very hygienic country, that is also a drawback of the India. Unavailability of the medical insurance, portability, and non-coverage of traditional system of the medicine. Another big drawback is that their insurance companies do not give portability in India. And so there is no use of their insurances in India. Another thing is that the traditional systems like that is Ayurveda, Unani, and other systems of medicines which are of the Indian system, they are not covered in the insurance. So all these are the drawbacks in our tourism. Legal barriers to medical tourism in India. Indian legal framework, when it comes to the medical tourism, is very limited. So, Indian framework of the legal is very limited. There are no special laws, no special restrictions, or no special laws made for the tourist medical tourism. The legal consequences are negligible in cases of any medical malpractice. So, if there is a malpractice, there is no legal support for that. You cannot say that how much you have to charge. One can charge anything according to his will and wish. So there is no ban. The present legal framework and laws are not adequate for efficient or deal with the legal scenarios that can arise in the future. So in the future, even when it will increase, the present scenario of the legal system is not sufficient to cope up. The need to decide whether the laws of the country you are visiting to the treatment will apply or the law of your home country. The question mainly comes when you visit and take the treatment in India, whether the laws of Indian laws are applicable or the country from which you are coming, the laws are applicable. In India, the Indian laws are applicable. But in some other countries, the different status is there. In India, the only laws that particularly deal with medical tourism are visa laws. So in India, main law is visa law that provides for a separate category of visa known as the medical visa granted for a period of 1 year or for the duration of the treatment, whichever is less. So if it is a less duration treatment, it will be for less time. This can also be extended in case of treatment will take a longer time for another 1 year by the Ministry of Health Affairs on recommendation of the foreign regional registration officers and state government. So it can be extended to another 1 year apart from the original 1 year. The extent of the extended time of the visa enables the patient to visit 3 times in a year. So when you take the M visa, you can come and go 3 times. You can have it on the same visa. There is no need to have separate visas at that time. And these patients can also be accompanied by a relative or a friend at the time of the medical tour to India. So another facility is that somebody can accompany either the relation or the friend with the patient. The laws applicable to the case of the negligence, the Consumer Protection Act 2019, the same Consumer Protection Act which we are dealing with, which covers our Indian medical profession, are applicable to the people coming from abroad and taking the treatment in India. Deficiency is usual considered to mean the fault. imperfection, shortcoming, or inadequacy in the quality, nature, and manner of the performance of the any services. This was not there in previous Consumer Protection Act. Now this is all included in new Consumer Protection Act. So the deficiency also is covered in the Consumer Protection Act. So all the rules, regulations which are applicable to the Indian doctors are for Indian patients. The same are applicable to the foreign patients coming for the medical tourism. The patients can sue a damages vicarious liability. Alternatively, a medical tourism platform can hold a hospital liable for the negligence of the foreign provider. Whether the Indian, so the vicarious liability as there is in India, Indian patients, the same is there for the abroad patient. When the India laws or the laws of their own country will apply. Once a person leaves their home country to avail treatment abroad, then the law of that country where he takes treatment will apply in cases sometimes goes wrong. So that is the rule, world rule, but some countries are exception to that. So if someone comes to the India, then the Indian laws will apply in case of any malpractice. The issue of jurisdiction, one of the results of the receiving medical services in a foreign land is in the issue of jurisdiction that will arise in case of any dispute. So jurisdiction issue is also there, but now in new Consumer Protection Act, the cause of action or also where the patient is living or working, that is the jurisdiction, but he cannot lodge the case in their own country. He has to lodge the case in India, maybe he living or from the abroad. Promoting services across international borders to attract overseas patients is subject to the jurisdiction and laws of that country. But some countries are having different laws, and so accordingly they will work. Since Indian laws will apply, the need to be more strengthened and must be clearer on various aspects. So they are not much clearer. So that the foreigners are not demotivated foreigners are not demotivated to come here to seek in treatment, as they will be unsure about the legal help that will get in case of something goes wrong. So they feel that whether the medical help, legal help will be there if something goes wrong will or not. In some cases, people to file a case against an Indian hospital or medical institution in their home land, then the question that arises is whether that particular court in a foreign land has jurisdiction over this case. So if a person who has taken the treatment in India, if he lodges the case in their country on that hospital or doctor, whether the jurisdiction is there to that court or not. The plaintiff here needs to prove to the court that plaintiff means the person who is there. There is this case that they can take action against an Indian service provider. So the service provider, if he is having his office in their country, then that case they can lodge a case in their own country on the service provider, and the service provider has to give all the things. So instead of the doctor or the hospital, service provider comes in between and he can be lodged on that in their own countries if the office or something is there in their country. Most of the times, courts do not entertain cases over the foreign hospitals or doctors who is not located within their geographical jurisdiction. Most of the abroad or anywhere in any country, they avoid. The Indian legal framework is very limited when it comes to the medical tourism. This is indicated by the fact that there is nobody who has been designated to address grievances and complaints arising from either negligence or deficiency in services in case of medical tourism. So there is no separate office, there is no separate authority, or there is no separate agency where a complaint can be lodged by these people. They have to go through all the things that the Indian people are doing. So they are just like Indian citizens and in for putting the case, and they have no such place where they can put their complaint. There is no specific agency or required for registration of their grievances or complaints. So no separate agency is there. Medical tourism, returning from the infection, particularly antibiotic resistant infection, could place others at risk of the exposure of the infection that are refractory to the standard treatment, which we have already discussed. So they can take that strain to their country and can spread that. Various forms of risk of commonly associated with the medical tourism are the medical tourists who fly abroad are ought to have a high risk of deep vein thrombosis or pulmonary embolism when a long distance air travel is there after the surgery. When they are going back, then this can happen: pulmonary thrombosis, pulmonary embolism, or a deep vein thrombosis because a long travel. They are at risk to expose to the blood-borne infection due to inadequate blood collection, screening, and storage protocols in destination countries. So that can also happen with a little bit negligence of the blood bank. Individual traveling for organ transplantation in particular may experience high rates of severe infections, complications because of inadequate screening products abroad. So, in particularly when there is organ transplantation, that infection rates or many other problems are there. Concern has also been raised that the medical tourists may transmit infection to their own countries. For informed consent, while obtaining informed consent, the medical procedure is difficult. Under optimal considerations, the participants expressed that patients may not be aware of the risk of the infectious diseases contracted abroad. So all the things are told, but they may understand or may not understand. But the risk of contacting the infectious diseases, and of that risk of organisms resistant to the antibiotics that may be covered or may not be covered. So informed consent may be sufficient or may not be very effective and informative to the people. Medical records, the medical tourism patients may not be able to obtain medical records about the information on whether the internationally accepted safety protocols were being followed or not is especially unavailable, and many times the records are meager records are given to the tourists, and it is not protocols, international protocols, whether they are observed or not, that is not clearly told to the patient, and the patient has no cannot ask the doctor or hospital whether the protocols were observed or not, or they don't have that much courage to ask the hospital, and so the terms it remains the same, and jurisdiction law applies to the circumstances of the medical tourism. So this is also a very big fact. Compensation is also another issue, as these patients are living abroad. Most of them do not wait for the file case and seek compensation due to slow judicial proceedings. So even if they lost the case, they don't wait for getting the compensation, and it becomes difficult to follow the case and get the compensation. Even though there are efficient mechanisms in place of check the compensation awards in being so outlined, things are now coming up. And now they can check there and go ahead. After a foreigner dies in India during surgery, what steps should be taken? Register the death. Register the death with the local authorities in the country where the person died. So so that is, if he has died in India, that is to be registered there. Obtain a death certificate get a death certificate from the local authorities, obtain a embalmment certificate. If the body is to be transported by air, obtain an embalming certificate that states the body is safe for transport. This certificate can only be obtained after getting the police clearance certificate. So first the police clearance certificate is taken, and then this certificate is taken that the body can safely be transported. Obtain the no objection certificate, that the NOC is the required. The embassy will stamp cancelled on the that is a passport is cancelled first, and then the certificates are given. Obtain the police NOC is also required to transport the deceased person on a cargo flight. Visit the local police station and inform them that a police NOC is needed. The police may ask so many questions. Registering the death and getting a death certificate. You must register a death in the country where the person died. Additional copies of the previously issued paper can be obtained by contracting the Department of the State Passport Visa Vital Record section. This is the organ donation of the foreign normal in India. Enables certification. It is important to obtain an embalming certificate that states that the body does not provide any hazard. So when the body reaches to their country, it will not have any hazard to the other people in their country. The embassy cancellation consulate can communicate with the next of the kin and communicates their wishes about the disposition of remnants of the local authorities, because in India the body is either burnt or it is buried, or the whatever is done, and what is remains the things that can be handed over to the next kin, and that can be done with this. The embassy consent will assist for taking that material to their country. The embassy will give their support, and they will give the next kin to help, and that all the things can be shifted to their own countries. The US government does not provide funding for help of the shipping remains or other things. The person has to do his own. The reporting of the death of a US citizen, the death of the US citizen in India should be reported to the embassy or consulate responsible for the Indian state in which the US citizen died. So that a US consulate report of death abroad can be issued. This document is necessary to settle the legal and state matters in the United States. So this report is very much required to settle the property matters. Please note that that you will need to courier the following documents to your office for us for issue of the consular report of the death abroad. Original death certificate from the local authorities, doctor's report with the cause of death listed if available, any crimination certificate receipt of the availability, and original passport of the deceased. Please be aware that the consular officer is required to cancel the deceased passport before the consular report of the death abroad can be released. So before that, the certificate is released, the passport is cancelled. Passport will be returned to the next of the kin. The scan of the next kin's passport, biography, a living will, if any, is there, that is taken care. So dark tourisms are another thing where the things happened very bad things happened. People like to go there, and that is also associated with the medical tourism. And dark tourism concept that is that wherever there was riots, there were so many people died, or so many things has bad things has happened. People like to visit such people also, and that is called the dark tourism. And that is also associated with the medical tourism. People take the medical treatment and also do the dark tourism. Atrocities tourism is also there, and morbid tourism is also there, which are there, associated or maybe not be associated with the medical tourism. Thank you very much. So I think I finish in time.
Yes, sir. Yes, sir. Thank you so much for your valuable session. It was a very informative session. Can we have a few words from one of our other panelists today? Starting with Dr. Mathur, sir. Anything you have to add?
You are muted, sir. Mathur, sir. You are muted. Yes.
Yes, sir.
Mathur sir, we would like to hear your comments about this topic.
It was a very comprehensive exposition by Dr. Deshpande. Like it encompassed all the facets about medical tourism. He clearly defined the types of medical tourism. He incorporated the issue of Ayurveda, Ayush medication, apart from the wellness thing and the real medical condition treatment in the country, the pros and cons, the advantages, the disadvantages. All in all, it was a wonderful exposition. Thank you, Dr. Deshpande, sir.
Thanks a lot, sir.
I had just one thing when you were presenting about the accompanying person getting an M visa. So does M visa also specify specifically as an accompanying person, or a person can come with an M visa as an accompanying person, get himself or herself treated also and go back? What
The
are
thing is,
the
yeah,
technicalities of that?
the thing is that accompanying person means accompanying person. He is not for treatment. But if when he comes here and to take the treatment, that is a different thing. Even if he don't want to take, he is not coming as a patient, or he is not coming as a medical tourist for medical purposes. Only he is an accompanying person, and still he gets the visa very easily. And all the times, that is 3 visits after the treatment in a year, also he gets the visa, maybe person changing. So there is a lot of scope of people to come accompany the patient and come here, may take treatment, may not take, may consult or may not consult, that is a different thing. But they can accompany with the patient.
No, for the security purposes, like is there a scope for misuse of this accompanying person? M visa came to my mind when you were presenting.
Yeah, that is true,
But
sir. When they come to the India and they take the treatment, security points are always there because they are not registered as a medical tourists. So if anything happens, that is the responsibility of the hospital treating or the doctor treating the patient, that patient, and that is also the responsibility of the agency which bringing that patient to the India. So main thing remains with the agency. Agency is more responsible for all the things, for the security, for the side effects, and whatever happens with that patient, because he is not registered as a patient for medical treatment purposes in the medical tourism.
and the clause of 3 visits during the time of visa is adequately catered to for the sake of follow-up of that patient.
Yeah,
That's
that
a
is
good
for follow.
feature in the
Yeah,
visa.
and which
So
can
it's
be
a sort of
extended
a
for 1 year.
pre-entry visa rather than a multiple entry visa. We have a special 3 entry visa.
Yeah, like a multiple entry visa, it is 3
Pre-entry visa.
entry visa, and
Sir,
which can be extended for another 1 year.
sir, if some person comes with a tourist visa, so as a hospital, do we need to check their visa, the like details of the visa before providing treatment? Like, can they take treatment with tourist visa also?
Yes. Whenever hospital or a doctor gives the treatment to a foreigner, he should first see his passport. He should see his visa, which type of the visa he is having, and whether he is insured in India or not. Again, if he is registered for the medical tourism or not. If he is not registered for the medical tourism, as an emergency patient, he can be treated. There is another clause is always there. If he comes here and gets the emergency, doctor or hospital has to treat. So also the accompanying person, if he gets the emergency, he can be treated legally also. So
Uh,
yes, please, sir.
Yeah, in our
Sir,
specialty, especially for cataract surgeries, we, especially in Hyderabad, we do get patients from Middle East accompanied by the local persons. And I don't think many of our hospitals, they really ask when they are operating a patient for cataract surgery, whether you are having a medical visa or a tourist visa. We just probably, most of us, we just go ahead and do the cataract surgery specifically. So this is a good thing that this
Yeah,
information should be said. Like,
yeah.
can we do this like this, or are we supposed to insist on an M visa and let our next door colleague operate?
Yeah, better to insist on M visa
Yeah.
sir, there
and
is one
then
sub
treat.
question, sir. Sub question from my side.
Yeah,
Suppose the foreigner is of Indian origin, and it is very difficult to identify him whether he is Indian citizen or the person from abroad. Now the question comes, if the person comes to your hospital for the treatment, and you cannot ask each and every person whether you are Indian or foreigner,
that is
and he
true.
doesn't disclose. If the person doesn't disclose that patient, then what is the role of the doctor and hospital?
If he doesn't disclose, that is not the doctor or hospital at risk, but he himself is at risk because he has not explained to the doctor that he is a NRI or a citizen of other country, a citizen of other country, but Indian origin. So doctor cannot ask, the hospital cannot ask everybody. That is for his safety. He has to explain and disclose it that. If he doesn't disclose, that becomes his responsibility, own responsibility, and the hospital will not be made liable for that.
Thank you, sir. I think your talk was wonderful and it had, I think, two parts. First part was very much pleasant. Everybody was thinking that I should get foreign patients and I'll be popular. My hospital should be recognized for that. And then second part came and everybody was thinking whether you should take the foreign patients or not. So that was about the medical legal complications and death and everything. So I have a few questions if I am allowed. I'll be asking those one by one. 2 to 3 questions are there.
Yes, sir.
First one is you're talking, and most of the things you already covered, but some specifications about those topics I'm going to ask. First thing is about the insurance. Now, the person who is coming from abroad has his insurance at his own country, medical insurance. He's coming to India for the treatment. Should he come and start his treatment with the insurance in India? This is my question.
The thing is that whenever he comes, he gets a insurance while traveling from their country to the India. In that, there is also a provision for emergency treatment when if any emergency happens. Likewise, he can also add a clause. There is clauses are there. He is going for medical treatment and he can have the insurance from that. And the separate insurance is there given when he starts traveling on the visa itself. But his original insurance company, which is covering him in that country, cannot be ported here. If that is an international company and he accepts it, well and good. Otherwise, generally not.
Now, there is the scenario the person doesn't have that particular insurance of his own for that Indian insurance, one may call it as. And now he has to pay from his own pocket. In
Yeah.
that situation, how do you tackle this patient?
It is mentioned many things that whenever this patient pays, it is well and good. If he doesn't pay, you cannot do anything because you cannot put a case on the patient for payment, or you cannot stop him or withhold him. You can only request follow and just to do follow-ups, and do the recovery. At the most, in the end, you can put a case for recovery of that bill from him. But as he is a living in other country, that will not be executed in their country by the local authorities which are there, even if it is ordered by the court in this country. That is
Suppose
the
he
problem
lives,
always there.
he's trying to leave the country without paying your bill. Can he leave the country because you have got
He
the,
can leave because there is no ban for that.
suppose you have made complaint against him that he has not paid the bill. In that case,
Even then, they can stop him for
okay.
going back.
Sir, my next question is now about the medical legal laws. Medical legal laws in India as well as abroad. And when the person is getting treatment in India, you said that medical legal laws in India are applicable. Now the thing is, there is CPA 2019 you have talked about, and there are few cases in India when we think about the profession of that person, age of that person, what he otherwise would have earned in his remaining life, and that way the settlement, that particular reward is being given to the patients and relatives. So that way this NRI or foreign person who is taking treatment in India is a problem for Indian doctors and hospitals.
Yeah, it has
Because he will have to pay more. He will have to pay more.
Yes, yeah. That is the thing which happened. Supreme Court has, that's why they charge in dollars.
Exactly. So we should be
And
allowed to
when
charge
they
more.
order in dollars, Indian person was to pay from the nose actually. And that was in lakhs or crores dollars. That case has happened in Supreme Court.
Sir, my
So
next question is, sorry, continue, sir, continue.
Yeah, please go ahead.
Okay, my next question is, there are few hospitals. For example, in Pune, there are recognized hospitals like Dinanath, Jahangir, Ruby, and they are the recognized hospitals, and there are private hospitals also. So is there any law about the recognition of that hospital to treat the foreign nationals?
Yeah, there is also an attachment, that is attachment to the medical tourism. You have to get attached. There is no registration separately by the Indian, but the agencies can attach you. So government is not giving any registration or any support or anything which is recognized by the government as a for medical tourism. But the agencies, they file and they accredit and they get registration of attachment with that hospital, and they treat the patient there only because they are having MOUs and contracts. So anything if happens, they can sue the hospital.
Sir, the last question from my side. The patient has taken treatment in India, maybe satisfied patient, satisfied doctor, and then the patient goes to his own country. This is first scenario. Second scenario, maybe there is some complication, patient is unhappy, and again he's going to his own country. Now, in his country, the doctor is saying that something has gone wrong. And now he feels that the doctor has not treated properly. And he feels that something medical legal litigation has to be started. What is the scenario in that case? He has already left,
In that case,
left the
he has to
country.
put the case in India. He has to put the case in India, or he can put the case, as I said, in their land on the agency which has taken them to the India. Because that office, if there is there, or some person is there, then only it is possible. Otherwise, the court will ask whether the jurisdiction is there for me to run this case. And the plaintiff has to prove that you have a jurisdiction for this case, and for that purposes, he has to show the address of the transporting company in their nation. Then the case can run on them, but not to the hospital, not on the doctors.
And sorry, sir, again, one more question. When the birth takes place in the aeroplane, probably that particular nationality given to that child is about from that airline. There is one example that it was the France airline and that person is permanent citizen. The big doctor from Pune is the French citizen. Now, suppose the death occurs after the treatment in the aeroplane, in the transit, then what happens?
So there are different rules for that also. For if the death occurs, that is to be communicated to their country, from where they are originating, and all certificates and all that is done in their country where it plain lands.
Okay. Thank you.
Sir, are
Regarding
there any,
medical insurance, okay, Kaushik.
sir, my question was like there are certain hospitals which are providing like paid fellowship to international citizens who the doctors who come here operate on Indian patients and go away like for 6 months or so. And I know a few institutes which are doing that. So what like are the legal framework for this? People, doctors from outside coming here and operating on Indian patients.
So in that case, they have to register All India Register, that is our medical council. Temporary registrations are available for such people who are coming to India and operating. But many times in camps, it is seen that they don't register and many problems come arise. But actually, legally, whenever they want to give any treatment or operate in India, they have to register with the Indian Medical Council, that is now National Medical Council, temporary
Commission.
registration, and that remains for 6 months, 1 month, or so the period of the visa.
Regarding health insurance, sir, like our companies, Indian companies, especially if you're having health insurance of over 25 lakhs, if you have a cover, they have a global applicability for emergency treatment. So you need not take health insurance for short trips when you are moving around the globe, the multiple visits. That kind of a thing is there. Is that thing available even for elective procedures? Especially
Uh,
suppose foreign patients having a elective procedure getting operated in India, do the insurance companies, their original insurance, support this kind of medical tourism?
that depends upon the insurance company. If it is an Indian insurance company and they taken the insurance in India after coming to the India or before the treatment, they can give it. And that can be a global insurance or some companies which are global itself, having all business all over the world. They can give such insurances if they desire and they feel fit. That is the discretion of the company and not the discretion of the person who takes the insurance.
But sir, very few people I think have insurance cover of more than 25 lakhs.
That is
I
very
feel
bad thing.
having insurance only is a like thing which one should aim at, and having insurance of more than 25 lakhs, I doubt that very few people would have that.
Most of the doctors should
I will advise not less than 1 crore one should have a insurance nowadays.
Health insurance.
health,
Health,
health insurance.
health
No,
insurance means
health,
He's
health
talking
insurance
about
is
our
Mediclaim.
health
yes.
insurance.
He's
Indemnity, I
talking
am
about
saying.
Mediclaim.
Indemnity.
Yeah.
No,
Yes.
no, I'm talking about
Yeah.
medical
Our health
health
insurance.
insurance.
25 lakhs is not sufficient many times.
No,
When the
especially for
Like after COVID,
globetrotters.
it is like
uh,
that, sir. Yeah.
Yeah, especially for globetrotters, like, like a 3 month travel insurance costs a bomb. Like, we really have to see how the premium works out. Better to take a 25 lakh cover all throughout that covers your global travel throughout the year, or you just restrict it to your 10 lakh cover or 15 lakh cover and then keep on purchasing global travel insurance whenever you are going out of the country. So it all depends on case to case basis.
yes, that everything depends upon the insurance who takes and the company who gives. But insurance should be more, I think. When the Indian goes to abroad for taking the treatment, 25 lakhs are nothing.
Yes.
But when the person comes from
To
abroad to
India.
India, if 25 lakh dollars are there, they are quite sufficient.
Yeah.
Dr. Nirmal has not joined, I think.
He had
Sir,
joined
I
for
spoke
some
to
time.
Nirmal sir. He said he will be in travel. He has to take a
I
flight.
think he has sent one PPT format on our WhatsApp group.
No,
If you
that sir, that was for intro slide. Actually, he might
That was
have made some
introduction
changes
slide which we
okay.
which we
included.
Okay.
incorporated
Okay.
actually.
Okay.
Sir.
Okay.
I spoke to him. He said he will be traveling, so he will join for a short time. I did
Okay.
mention that it will be good that if he is there for discussion, he said he will try. Anand sir, thank you so much. I never knew there is so much
Okay.
of content in this topic, and the session was very, very informative.
Thank
Dr.
you.
Kaushik, if you have any question, you can continue.
I think everything was covered, and it is a very important topic because we need to know, and nobody checks actually, as Manoj sir said. We have also treated international patients, but we have never seen their actual. We have had their passport, but the visa we did not check, like whether it was a medical visa or a tourist visa or anything. So
One
that is.
wonderful case happened in Aurangabad. One dentist was doing some dental procedure on a foreigner, and he never taken care what happened not in Aurangabad, that is in Pune. It happened in Pune. And the forceps, small instrument which they were using, was swallowed by that person in the stomach. And then the question came, then how to do, what to do, and what not. And apart from that, there was no consent of the patient also taken from that, not review about not as a Indian citizen, but simple informed consent was not taken. And fortunately, the doctor was very lucky. He taken to the other ENT surgeon, that is the gastroscopy surgeon, and he removed with the scope and without any injury anywhere. And the patient was so happy that after this emergency also, I am safe, and with I don't want to even sue you, or I don't want to blame you or anything. I want to do only they cancelled their bills and the doctor's bill of the endoscopy, and he was very happy. So such things, such lucky doctors are very rare.
And who would take an informed consent saying that possibility
Yeah,
of swallowing the instrument?
yeah. Actually, it happens in dental treatment many times. Small instruments are there, and that can be swallowed many times. The same thing happened in Pune also. The abroad person was treated, and he had a lot many problems and everything, and he wanted to put the case, and so, but he was not having time, so he gone back to the Arab countries back, but he did not put the case. So these things go on because they don't have the time, or the compensation in the form of rupees is nothing for them. For that purposes also, they don't want to waste the time. So the cases are very meager in that in these situations. Such cases, I come across at least 2 cases where these things has happened.
And also our courts help because it will take so long time that they'll
Yeah,
not be.
yeah, that is the thing. Time factor.
Correct.
Time factor.
And that person has to come so many times to India for that
So
follow-up
that
purpose.
cost cannot be counted if consider to the damages that he going to
Exactly.
receive.
Yes, sir. Are there any more queries or comments? It was an excellent session as always. Uh, Everything about the medical tourism was told by Anand sir, and we are grateful to Dr. Manoj Mathur sir and Dr. Prakash Marathi sir who have been guiding us since the beginning, and we are lucky to have finished 26 sessions on medical legal aspects, and we have covered almost
Get to
all
go.
the important topics, and we will be continuing in more depth in other next sessions. Thank you, sir, and I thank my colleagues in the medical legal team, Dr. Aarti Hedar, Dr. Dipanshu, and Dr. Riddhi Setia for helping us out. And have a good day. Thank you, sir.
Thank you.
Thank you.
Thank
Thank
you so
you.
much.
Good
Thank
night.
you.
Good
Bye.
night.
Good night. Thank you.
Good. Wonderful.
Sir, recording थांबले का? Kaushik sir.
Yes, yes, Manjula madam, can we stop the recording?
Let's stop the recording.
Okay, doctor.
Yeah.
Once again, doctor.